about sitting on these chairs, you kind of you feel like doing this. It's almost every time. In fact, that's how we should have started the show. Hold on. In 3, 2, 1. Good morning. How are you doing? Very good morning to you, and thank you so much for tuning in on this beautiful Wednesday. It's been a good week. It's a week where I'm back. I'm so excited. That's why you can see I am excited. I'm excited today because not only am I hosting the show, but I get to learn and hope that you at home get to learn as well. It's about Myasthenia Gravis. Did I say it right?
Yes.
Oh, yes, I've been practicing. So I want to find out what it is, signs and symptoms, and as I've learned, management, right? So we want to delve right into it. And of course, because I know my mom is watching, ladies first in terms of introductions. So it's with you, Doc, familiar face. Yes, go ahead and introduce yourself.
Hi, Willis.
Hello.
It's good to have you back.
Thank you very much.
So hi, everyone. My name is Dr. Elizabeth Waroy. Yes, from Mata Hospital.
All right, karibu sana.
Hi, everyone. My name is Terry Kimani. We are Myasthenia Gravis Society of Kenya.
All right.
Good morning. My name is Donald Kimtai from Myasthenia Gravis Society of Kenya.
Good morning. My name is Sham Lechiri from Myasthenia Gravis Society of Kenya.
All right. So you, the three of you are Myasthenia Gravis survivors. We said
Warriors.
Yes.
Warriors, right?
Yeah.
So, all right. So you've been diagnosed.
Yes.
All right. So we're gonna delve a little bit deeper into that. In case you have some questions in the course of the show, you can ask them on 2242 or use the hashtag Daybreak, and we'll be able to ask Doc or the MG champions as well. So, Doc, maybe you can tell us about the disease. What is Myasthenia Gravis?
Okay. So yes, Myasthenia Gravis sounds like a very huge name or a very difficult term, but in simple terms, Myasthenia Gravis is an autoimmune disorder of the neuromuscular junction. So it's characterized by production of autoantibodies. Autoantibodies are antibodies produced against the body itself. So you have your body fighting against you. So when you have, now in Myasthenia Gravis, what happens, you're producing autoantibodies against receptors in the neuromuscular junction. I take you back to a bit of physiology. In physiology, you have all muscles in the body have something we call a neuromuscular junction, and this is a junction where you communicate. There's a communication between nerves and the muscles. So when there's any disturbance in that junction, when there's any disease, that is affecting the junction, then there won't be good transmission of impulses. There won't be good transmission there won't be good conduction of information or communication between the nerves and the muscle. So for someone to move about their muscles, for you to contract, for you to flex or extend your muscle, there's a communication that is going around in your body from your nerves to the brain and then to the muscle. So now when this is tampered with, or when there's something affecting that cycle, and now in Myasthenia Gravis, when the autoantibodies are produced against the receptors that help with that transmission of that communication, then now you have symptoms. And the common symptoms that one will present with in myasthenia is things like weakness. You present with a general weakness of muscle, and this is weakness that occurs with time, like it is worsened as the day goes by, or worsened by exercise, and it's improved by rest. So some of the common presenting, or the most common presenting symptom that one will have with is muscle weakness or muscle fatigability. Yes. So that's
how do you kind of know that it's a symptom and not just maybe you're unwell or you're just tired? Like how do you know that, okay, I need to go get checked?
So it occurs over time.
Okay.
And we'll learn more from our warriors here because they've actually gone through it firsthand. Yeah, so it's something that will occur over time. There's that general weakness or that general malaise and fatigue that any person can have after having a long day, after working for long hours. So there's that is. You can find an identifiable cause. But now this one that is occurring from time to time, every single day, over a prolonged period of time, then you as an individual, you'll find that it's abnormal. You'll start seeing that it's actually, there's worsening of symptoms. So at first, maybe the common symptom that I've seen people present with, especially in ladies, they'll come and tell you that when they're combing their hair, they'll start getting fatigued and they actually have to rest first to continue combing their hair. You see, usually when I'm combing my hair or when a lady is combing their hair, you will comb your hair and you will finish. Yeah, unless maybe your hair is very long, but you'll finish and, you know. But now when someone comes with a complaint that a simple task such as combing your hair is becoming tiresome or you get fatigued very easily, then now that is something you have to look into. And then there are things like ptosis or drooping of an eyelid. So when an eyelid is, you're not able to close it completely, or even when you're opening, you're not able to open it completely, that again is not something that is normal. So when you see that, you're supposed to at least seek healthcare, seek medical attention rather. So yeah.
All right, and so the three of you, you know, and we were talking about it earlier, have been diagnosed.
Yes.
Right? So what sorry, what prompted like you to, you know, when did you know that, okay, this is becoming a problem and I need to go get checked?
Okay. For me, I woke up one day with a droopy eyelid. My left eye, it was droopy. But then I didn't know. So my family members were like, what's happening to your eye? So I thought something maybe beat me through the night and it's going to get better. But 3 days later, all of them were down. They all drooped. Now fully I could not open, so I was just struggling to see and things like that. Initially I thought it was maybe an eye problem. So I booked at I went to Aga Khan, booked to see an ophthalmologist.
Okay.
When the ophthalmologist saw me, immediately she said that she's suspecting that this is not an eye problem, but she said let's just do the eye checkup to confirm if everything is okay and fine. And then when she did it, when we had all the tests, initially, you know, when I was there, she said she's going to put me on prednisone because my eyes were checked and they were okay. I could see fine if I'm holding my lids. She said we need to do some tests if she's suspecting, but she's suspecting it must be Myasthenia gravis. At that time, it was very foreign for me, so she wrote it down for me to go and research. The tests were done. About 2-3 weeks later, they came back positive and the acetylcholine level was so high. I think it was about 27.1.
Right. Hold on, right there. What is that?
I think it's one of the tests that they do to determine if you have Myasthenia gravis.
Okay.
At that time I did not understand, but she said we have to do the test to know if this is an actual thing. So normal levels, it's between, I think, 2 to 4.
Yeah.
But mine were 21 point something. So for her, that was just, immediately she sent me to a neurologist. And now that's when we began the treatment process. Yeah.
So you actually have to go to a neurologist as well?
Yes.
Okay.
The only person who can actually treat Myasthenia gravis, who understands, is a neurologist.
Yes. Who are, by the way, for your information, ladies and gentlemen, because I had to look for one, there are very few in this our Nairobi. I think there are 4.
Yeah. There are 8. I think there are 8 in the
Kenya.
whole of the country.
Yeah, there are 8 in Kenya, 4 in Nairobi, 1 based at Aga Khan, at Tokangi hapo, and then the 3 wako na practice. So you see, anyway, that just tells you again how, and we'll talk about the cost and everything a little bit later on. What about for you? How was?
So for me, it started with the eyes. I was out hanging out with my friends. I noticed we were taking selfies, and then when you look at the photos, one eye is down. I was like, maybe I was just tired. So I went home, ignored it as normal. So over time, it progressed, as Doc said. The symptoms, they don't come at once. They progress. So it started from the eye. I remember I went to Lions, they checked, it was okay. The doctor told me I'll not even give you an eye drop, just to check your eyes are okay. So I went, it came to the voice. I remember I was at a work meeting somewhere in Mombasa. I couldn't speak the whole sentence. You speak, your voice, in the middle of the sentences, you cut, you stop. You have to take a break. It progressed, it came to the hands. The way Doc was saying, even showering, leave alone combing your hair. You can't shower, you take breaks within your shower. So at that point, I was like, what is going on? And then the issue is, you're going to doctors, you're going to the emergency rooms. They're not picking it. So it takes a long time, because my first symptom presented itself around August 2016. I remember I got my diagnosis in May 2017. So a whole year of thinking, what is wrong with you? So it progressed till, I remember, Monday, you can go to work. Tuesday, Wednesday, you can't even wake up. Your legs, they shut down, your arms shut down. They can't even focus. So over time, I remember, personally for me, Google saved me. I just put my symptoms on Google. Because I remember my eyes, my voice, my arms, and then even food. You can't take meat. You can't. So my diet basically switched from things like meat. You now start eating rice and beans, rice and ndengu, those soft meals, so that you can swallow. It got to a point. Now I Googled my symptoms because I was like, what is going on? After I Googled my symptoms, Myasthenia gravis came on it. I was like, no. I was like, this is not what I have. So I remember that was in February, March, when I Googled my symptoms. So I went into I said, this is not what I have. So it took so long. And then in May 2017, I was like, let me go. Because I did the research. As Doc said, it's a neurologist who can
Actually,
diagnose you.
Yeah.
So I remember I went to Mater Hospital, and I just said I want to see a neurologist because I'm presenting symptoms 1, 2, 3. I was booked. And sure enough, I remember it was on a Friday afternoon. I was given prednisone and mestinone. And by supper, I could take my meals comfortably. The next morning, my arms, the fatigue had reduced. I could shower properly. So, excuse me. So at that point, I knew this is what I was going through over my body.
Yeah.
Yes.
And you talked about it earlier, how that's the other thing. Before you actually get diagnosed, you get misdiagnosed.
Yeah.
Like, same thing. Like when you go to the doctors, like for me, same thing. You go to an ophthalmologist, and they say like you might need specs, but I'm like, that's not what I need. That's just a symptom.
Right.
And for me, I can just start by how mine began. Yeah.
Okay.
I was going to work in the morning. I was driving. The car in front of me split into two.
Yeah.
So you're like, what just happened? So I had to park on the side, and then I was like, okay, fine. I'm halfway there. Let me just get to work. So basically, I drove to work with one eye because I had to close one just to make sure I can see where I'm going. So I got to work, and then then I was like, oh, there's something wrong here. So that's when you go see an ophthalmologist, and then for me, they told me I'm lacking B12. Yeah, like I'm lacking vitamin B12. So I was on injections for like a month.
Yeah.
Every
Government of Kenya, watu wenye wanaogopa injection watafutio tembe.
Yeah, so every week, every Friday, I'd go to AR in Westlands to get an injection. I think all those nurses
Knew
get
you.
injection. So, and then you get to go to.
So with this, over this time, with the B12, the symptoms were still there?
It was helping. The symptoms were still there.
Okay.
But it was kind of helping.
Okay.
And then, same thing. Again, same thing. Trouble with eating, swallowing. I think for me, what I knew it was serious is when I was eating and I couldn't swallow.
Yes.
I was like, okay, there's something wrong over here.
Yeah.
So managed to go to a neurologist at Aga Khan.
Yeah.
He saw me and he just knew. He saw me and I was describing my symptoms. Then he told me what I was going through, and then so he put me on again mestinone and Feds, and it actually helped. It was like instant. I was like, wow.
Yeah.
It's like becoming a junkie, but
Get the point.
Yeah. So the medicine that they're mentioning, what does it primarily do?
Okay, so I'll be a bit technical. So with myasthenia gravis, what happens is you're producing autoantibodies against acetylcholine receptors. What you mentioned, acetylcholine. So that's a neurotransmitter that helps in the relaying of the communication, as I had earlier mentioned. So now if you're producing antibodies against this neurotransmitter, acetylcholine, so now the medication means now you'll need that acetylcholine. that's what you'll need in the management. So what it does is it helps improving the contraction of muscles is better. The relay of those symptoms, the relay of the conduction now becomes better in the neuromuscular junction, because when you destroy the receptors, that acetylcholine that is there cannot be transmitted. Yeah. So once you give that medication that has that the chemical itself, it improves the symptoms, because now the impulses can be relayed properly in the body. Yes, and I wanted to add on the symptoms they're mentioning. So in myasthenia or in MG, what the main muscles that are affected are the facial muscles, the head, the neck, the bulbar muscles. That's why all of them are mentioning. Bulbar muscles help us in speaking, in swallowing, in chewing. So that's why you're hearing the two of them mention that they're unable to chew and to swallow. Yeah, so when your bulbar muscles are affected, then now that means chewing will be a problem. Speaking, he mentioned he was not able to finish sentences. And sometimes even your voice changes. You get something called dysphonia. So your voice changes. He mentioned diplopia. So he mentioned doubling of vision. In medical, we call that diplopia. Yeah, so you get to see double vision. Your vision is impaired to some extent. That's why some of us doctors refer you to an ophthalmologist. But yeah, so we start with first things first. You see, most of the things in medicine we do by ruling out. But again, if you're able to come with a whole spectrum of clinical symptoms, it's spot on. Like when you say you're having that drooping eyelid, you're having that difficulty in swallowing, you're having weakness of the muscles, it's very easy to spot. But now if it's just the drooping eyelid at first, we'll send you to an ophthalmologist. Yes, anyway, so the drug, as you were asking, it helps with improving the contraction of muscles, so that you're able to flex, you're able to extend. Yes, the transmission is better.
All right. And so for the three of you, I guess the other thing that happened, because you were at work,
Yes.
you were driving on your way to work.
I was at home.
You're so then that then means the people around you are also wondering what's happening. So how were you in the initial stages before you found each other? How were you able to cope and deal with that?
It was crazy. I remember I thought I was alone in Kenya with Myasthenia Gravis. And as soon as I was diagnosed, when I went to see my doctor at Aga Khan, Dr. Mativo, he kept on explaining what is happening to my body. And he told me that there are people in Kenya with Myasthenia Gravis, but at that time you're thinking, where can I find them? So I remember what I did. I went online, I found Myasthenia Gravis Foundation of America, and I joined that group on Facebook. So I could see. And then the worst thing about going to search forums when you're not ready, and when you're just diagnosed, you see guys are dying and things like that. So it gets to you. And I remember I was a very social person at that point. But then as soon as I started researching more on what happens to people with Myasthenia Gravis and the fatality rate, like it just became so scary that I withdrew. At some point, I think I even had a mini depression because things were happening so fast, and then you're trying to look for remedies and things like that. But I remember my doctor, immediately he said that there's a surgery, thymectomy, whereby when you have the thymus gland removed, you may go into remission. And I don't even think my family thought twice about it. We're like, oh, so you can actually get into remission, so let's go and do it. And immediately we went and did it. But years later, we have members in our group who've never had thymectomy, and they're doing well. They're doing
And this
so
is
well.
out of choice or because it's expensive?
Out of choice.
Okay.
Purely because they're scared of going through surgery, because it's an open chest surgery. So even to have it, like when they're explaining what will happen, it's very scary and very graphic. But yeah, so we decided we'll do it fast, and we did it, and for 2 months I was good, but after that, now all the symptoms that you can experience of MG hit me. They hit me hard. I couldn't do the basic things like dressing, washing myself, all those things became a task. So yeah, they put me on heavy medication for a very long time, up until 2019. And then the medication just stopped working for me. Hence why now we sorted out. At that time, I think rituximab had just come. So they were testing it out in MG patients. And I was the first one in Kenya to ever try it. Yeah. And Shem came the next day and did it.
We're in the same ward.
Yes. Yeah.
Sides.
Yeah.
Okay.
We were visiting each other. And as soon as I got to Tuximap, it took about 9 hours because it was drop by drop. They say that they do that because it's a medicine that can take you to ICU as well.
Yeah.
It can work both ways. Yeah. So yeah, for me it worked. Then the next day, I could just feel my legs, I could feel my strength. I'm like, And the worst thing about having MG was going to the washroom. I could never go to any public washroom because I would fall.
Yeah.
So that for me was a very bad experience. So what I did, I said, let me try going to the washroom. And all of a sudden, I can squat. I'm like, So yeah, that was it for me.
That's great. Before you describe, I want Doc to try to explain to us what the surgery is.
Yeah, so in myasthenia gravis, the most common cause that has been identified is having thymus hyperplasia or a thymoma. Yeah. So thymus hyperplasia is enlargement of the thymus gland. Thymus gland is a gland found in our bodies. It's between our lungs, just in front of the heart. So its main purpose is immunity. Yeah, so when you have enlargement of this gland, or when you have a tumor in the gland called a thymoma, you'll have now these symptoms of myasthenia gravis. So when you're diagnosing, there are usually some modalities we use in investigations we do in trying to diagnose. You'll do things like electromyography, and I'm sure they've all been done for the electromyography. You'll do things like there's an assay trying to check for the antibodies, the autoantibodies that are causing the disease, and then a CT scan of the chest. So in that CT scan is where you're able to check and see, is the thymus gland enlarged? Is there a tumor in the thymus gland? And once it's found, then now you're done for a surgery, as she mentioned.
So is it only removed if it's enlarged?
Yeah, if it's enlarged or if it has a tumor.
If the presence is there.
Yeah.
What the doc is saying, you know, we become doctors. you experience this thing, the amount of reading you do, you have to have the information if you want to manage the condition yourself. Yeah. So what doc is saying, basically from my research, I might be wrong, the thymoma, the thymus gland is basically present from when you're born till the age of puberty. And then it's a muscle, then it shrinks. In a normal person, it doesn't exist. But in people with MG, it is there, and chances are it is enlarged. Like for me, mine was, when we were in the reception, I showed them the photo because I have it. It was huge. So it is removed. That is another painful procedure you don't want to ever experience in your life. So I don't know what it does, but it helps in the management of MG. So basically, the thymoma is the thymus gland is not present in a normal person who does not have MG, rarely. But with people with MG, it is one of those things that is there.
Wow, so many questions. But so the pain you're talking about, it's like in the healing process after.
Yeah, after the surgery. That thing was huge, and I never felt it before that surgery. It is huge. You know, I remember I got the surgery in September 2017. I was out of work till January 2018. Because, you see, have you ever slept sitting down? That is the only position you can sit, like this.
You can't sleep.
If you cough,
lie down.
It's painful.
If you laugh,
Painful.
if you move, ile enye umelala tu hivi alafu usonge, you will wake up screaming.
Even walking.
You can't even walk. So you are out for 4 months, 3 months, 4 months.
And so again, I go to what was family, friends doing, you know, this time, because again, it's and even yourselves, like, was there some sort of therapy? How are you willing yourself to keep?
I think for us, it's like once you get the surgery, it's like a day at a time.
Yeah.
Because like what happened, like on your road to recovery, I couldn't even take my hand up because of the pain. Yeah. I couldn't even lift my hand. Yeah, so someone had to help me shower. Remember that time, and also just taking walks. Like let's say again, as I say, day at a time, like let's say day one, literally I can just walk from here till that door. That's it.
That's it. You're done.
Done for the day. The next day, I'll walk from there to like, let's say,
The corridor.
First day 5 minutes, maybe next day another 10 minutes, simple as that. And then there's one day my brother took me up a flight of stairs. That was the longest. I felt so tired. I just came back and slept the whole day after that. So I think it's just, as you're saying, willing yourself day at a time and having family around you to support you during that time.
Yeah.
That was really crucial. Yeah.
So coping with it. So I guess if you said that, you know, you become a doctor, I imagine your family is also digging in and dealing and researching and then also how, at what point now did you guys, you know, come in the group before you decided to register it as a society?
Yeah.
Okay.
What mulijuana vipi lini?
So, as you're saying, any autoimmune condition, not there are so many, and I would love people to get to know these things. Just search autoimmune conditions on the net and just find out. There are so many. So, apart from the patient, the people that bear the most brand are, first of all, your family members, your spouse, your children, if you have them, your colleagues at work. Because now you come from being the productive person to this person who you can't hack 8 hours a day, Willis. You can't. My lunchtime break involves me taking a nap, and my week normally is 3-4 days maximum, and this is not something you can help. So your colleagues have to understand you very well. Your family, during family events, you might be present. Sometimes you're not present. The hospital runs, you wake up, you call, assuming you're living alone, or mom, some things like that. You have to have those people that you can call at the middle of the night. I remember Terry called me, Terry's husband, when we were I knew her. That's how I came to know her. Terry's husband called me one day at 1 a.m. when she was going through a Myasthenia crisis. That's the... These are the things people in our lives go through. You go to hospital at weird times of the day. You are not... I think you get what I'm saying.
Right.
So those people, if they don't understand it, you'll have a very difficult time. But if you get these people that are supportive, Willis, even someone taking you to hospital, just going to sit by that chair and taking you through that your consultation, it is a very good thing. Going through the admission, someone is there to admit you, to discharge you. It is a very, and you know, it looks like a simple thing, but you can ask your friend today, next day. By the third time, and you know the friendships that we have nowadays.
Yeah.
They are so frequent.
Social media followers.
Yes. So if people cannot understand you to that level, excuse me, it becomes very difficult. But if you have the love and the support around you, it becomes a very bearable condition. When you asked about how we formed MG.
Right.
That was in 2018. I remember someone from another group, she has arthritis. She's called Mary. Mary introduced me to our friend Alice. At that time, I felt like heaven. I was like, whew, come, it's not me alone.
Right.
So once I met Alice, at that point, MG was born. So we started, I remember it was Alice and myself, and then I remember Mary Kate, and then Elle, and then someone brings someone else, the doctor sends someone your way, and then to this date we are around 80 of us. Okay. We formed a group called Myasthenia Gravis Society of Kenya. We support each other. You know, if you find us talking about our condition, you might think it's not something serious, but that's how we communicate, and it's like therapy for us. You know, I can tell you, you'll be like, no, nah. But if I tell Shem or I tell, she'll be like, I've been there. And then you'll feel like, it's not me, it's not me.
You're not alone.
So someone else has gone through this journey. It becomes easy, it becomes bearable. And then there are those small hacks that we help each other with. you know a good doctor somewhere, you tell her, I think you should see
This doctor.
there's this lab, this lab has told me these tests cost this much. Don't go there, go this
there.
place. It's a bit cheaper. Where do you get your meds from? I get from,
Sinai.
we know another place. Go somewhere downtown, uko chini, go and buy from there. That's how we help each other. And then it becomes, life, if you don't have friends and if you don't have supportive people, it becomes another thing.
Yeah.
So for MG Society of Kenya, that's how we help each other out. Yes.
So Doc, just for people who are watching, so how, basically it's about management, right?
Yeah.
In terms of, so is management, are you on medication, like they're saying, over a period of time? Is there a chance that, you can be free of it? What are the medical chances?
Okay, so first I'd like to commend you guys, what you're doing. It's such a commendable job. Creating awareness, forming a group to support each other. That's a very good. It's amazing. Yeah, and let me take you back a bit, Willis. You mentioned that there's a time she had a myasthenia crisis. Yeah, so a myasthenia crisis is where you're having your respiratory muscles are failing. So you're unable to breathe. You're having respiratory failure. So this is a patient who will need HD or ICU care. Why are you admitted in the HD or ICU? Yes, because now you'll need ventilatory support. You'll need to be put on a machine. You'll be, all those tubes. So this is a crisis, and once you have a myasthenia patient with you, you need to watch out for such symptoms. If they're having any difficulty in breathing, yes, this is a patient you need to rush to the hospital immediately. So a myasthenia crisis is basically that respiratory failure because you're unable to breathe, because you're having respiratory weakness of the respiratory muscles. So coming to your question, Willis, on the management. So there are different ways to manage myasthenia gravis. The old drug, or the one that has been used for a prolonged period of time, is known as pyridostigmine. And yes, it brings the acetylcholine, which now is lacking in the body. You use this drug for, there's a period, it's mostly depending on your symptoms, but sometimes you even put on it for lifelong, because it's a chronic disease. So depending on your symptoms and depending on this disease is a remission relapsing illness. So there's a time you relapse, so that time you started again on medication. When you remit, the medications are stopped. So depending on your symptoms, and most of the time you'll find you'll be on the drug for a prolonged period of time. And as I was talking with these warriors, they were telling me that most of them are on rituximab and they've not used it for a period of time, right? So that shows you that you can be remitted from the illness if you've been able to control the symptoms properly. So those drugs are some of the drugs you can use. In severe cases, there's something called plasmapheresis that can be used, where you separate the blood. The blood is taken out of your body. You separate the cellular contents, you remove the plasma. This plasma is the one that has those autoantibodies. So you remove those autoantibodies that are causing the illness, then you return the blood now back with new plasma in the body. That's when it's severe. There's also immunoglobulins, IV immunoglobulins. One of you had mentioned you've gotten them.
A member in our group.
A member in your group has gotten them, which is very, very expensive, and the effect doesn't last long, at most 3 months. So those are some of the modalities of management that are there, and it's very expensive as they're saying. That's why I'm happy to hear that they're able to help each other in terms of cost, telling each other buy this one here, because it's quite expensive. And the rituximab is a monoclonal antibody, which is also, it's not cheap. So those are some of, and now the final modality is the surgery, where you're done for the thymectomy. You remove the thymus gland.
Right, and so after that, after like removal of thymus gland, based on just how they describe the healing process and stuff, that it helps significantly?
It does. Okay, like it depends. Like for me, it helped because, like I said, before I got the thymectomy, like I'd raise my hand, it goes down just by itself. I'm like, what the heck is going on? So I think after that I got, for me it helped because I got my strength back. Like I could lift my hands up. I could, again, as I was saying, day by day, you can walk longer. So I mean, my strength.
The other thing is, it is with any chronic autoimmune condition, one therapy does not suit all. So in MG, we call ourselves snowflake warriors because the medication I'm on might not work on Shane. What he is on might not work on her. So every person is different. And then the other thing people should know is today doctor has said, today you're okay. There's a day I remember I went to work with crutches. Now everyone is asking me, what is wrong? Where did you break your leg? That is when now you need support because you're weak. So if you don't go with that crutch, you will fall. So people should understand that hizo dawa ndo zinatusaidia every day to be able to function properly. Yeah.
So okay, I don't know, I'm told we have some feedback. We'll take them first. All right, let's take the feedback and then we'll come and ask more about the society. Someone is asking, how different is MG from Down syndrome or Downey syndrome?
Okay, I can answer that. So Down syndrome, that's a genetic condition, chromosomal disorder rather, that is caused by mutation of a certain chromosome called the chromosome 21 in the body. So it's very different from myasthenia gravis. Myasthenia gravis is autoimmune, so you have your body fighting against you. This other one is a chromosomal, you're born with it. Yeah, so it's genetic.
Okay.
Yeah.
But there are no similar symptoms.
MG is not genetic.
Yeah, it's not genetic.
I cannot transmit it to my child.
Okay.
I cannot transmit it sexually to my wife or my girlfriend. So it is me. MG is me.
But can I correct you? Yeah. You can actually transmit it to your child.
Yeah,
during
but
There's a small
Yeah.
incidence of it being genetic.
Yeah,
Yes.
but not it. And for that one for
newborn,
that one
when you
disappears
it
with time.
disappears with time. Like the first few months, your baby can have MG if you have MG.
Yes.
But that's why when you give birth, they take the baby first to NICU to monitor and just
Okay. But you say slim chance, but it's there.
Very
But
slim, very slim.
but also for me, we read a lot. So what I know is probably my child has that chance of getting an autoimmune condition is higher compared to someone who does not have an autoimmune condition.
Yes.
They will not get it necessarily, but their chances are higher than the normal child. Yeah.
All right, let's take the next question or feedback. This is Peter in Busia is saying, is muscular, you know this word.
Muscular dystrophy.
Yes, the same with MG. And is there any treatment? My grandchild is 8 years old and has the disease.
Okay, so muscular dystrophy, actually that's the age group which it affects from between age 8 to 15. Mostly it affects young boys. Yes, so are they related? I'd say they're related in the sense that they affect muscle, but muscular dystrophy is mainly where you're having muscle weakness. It progresses distally, going upwards. In myasthenia, you'll find it's more proximal, going down, or it affects the limbs first before it affects the upper limbs before it affects the lower limbs. So with muscular dystrophy, you're having abnormality in muscle. So your muscle is not able to contract properly. It's not able to flex or extend properly. So it's a disease of muscle, usually affecting young boys. Yes, it can be managed. There are drugs to help with that. And also occupational and physiotherapy is also very important with that. Again, it's a chronic illness, but I've seen 2 patients who've actually gotten out of it. So usually with time, with proper management, yes, you can be treated. So I'd advise him to seek help.
All right.
Yeah.
The next one, he didn't leave your name, but it says, shed some light if the condition occurs in the lower abdomen area or legs and almost prevent walking or mobility.
It actually can, because we have a member, Anil. She's been on wheelchair for the longest of time because her limbs have been so weak. And hers, it's purely MG, myasthenia gravis, whereby her muscles just shut down completely. She's been on treatment on and off. But then with the inconsistency of treatment, because it's very expensive. MG is a very expensive condition.
To manage.
Without proper health care, without things like that, you tend to relapse more than anything else. So with her, she's been on wheelchair for the longest of time. So I think I would say that, yeah, it can prevent mobility for the longest of time.
Right. Okay, and take one more. That was the last one for now? Because I don't know, you've just read.
Yeah.
All right, thank you. Are there medications I should not take if I have MG?
Yes.
Yes. So with myasthenia, and I think they'll add, I can see all of them smiling. Yeah, there are quite a number of medication because despite having a causative factor, we have things that will exacerbate the symptoms or increase them. So there are antibiotics that are specific, things like ciprofloxacin, that's an antibiotic, things like gentamicin, things like neomycin. Those are big names, but be specific to your doctor. Before they prescribe you any antibiotic, tell them I have myasthenia gravis. So once you tell a doctor that, they'll be able to know that they are not supposed to be on this kind of drug, they're not supposed to be on this kind of drug. Yeah, so some antibiotics, and I think maybe they can add on, maybe depending on their experiences.
Also things like vaccines.
Yes.
You cannot get yellow fever. You cannot get a yellow fever jab. So if you have MG, that is one thing you should always be aware of. Especially
the COVID vaccine?
COVID vaccine, initially I was very skeptical about it, but eventually the doctors, all of us, I think, we got. Because the doctors were like,
we need it.
we need to.
We need it.
I think in terms of medicine that you should avoid, what I do for myself, whenever I go to the hospital, because you know sometimes you meet doctors who don't even know MG. They see it with you, like you're the first patient they've ever seen. So what you do, what I say, every time I get medicine, I have to research. I do medicine. Before I start taking the medicine, I go on Google, like Google effects of the medicine, if it can trigger any symptoms of MG, and that's what I do. I wouldn't say there's a list we have in the group that medicine you should avoid.
There's also an app called Medscape. I use it personally. I don't know who told me about it, but it tells me drug interactions. So assuming right now I'm on rituximab, I'm on prednisone, I'm on mestinon. So whenever I visit a doctor and they give me my medication, I just list my, it has up where you list the medication you've been given and the medications that you are on. So if there are any interactions, it usually flags it up and then it tells you can't take that medication.
That's nice. That's pretty.
That's a good hack.
What's the name of that?
Medscape.
Medscape. Yeah.
Right.
We actually use it a lot as medics. It's a lifesaver.
Iko kwa Bialuo, iko kwa iOS.
Even by iOS, please.
Android. All right. They say we have one more for now because of time. This is Francis from Githukuri. Says niko na shida kama hiyo mnaongelea naweza saidika aje, please help. I guess I think the first thing would also, apart from getting treatment, how can which is now to talk about society, how can people get in touch?
Well, this is the hardest thing. With Myasthenia Gravis Society, as we're starting up, people think that we have funding, and things. But what we do ourselves, we fund ourselves. When we have a patient or one of our members who's struggling, what we do, we just start raising funds for the person and to try and just see what we can do. But honestly, if that person is suspecting he or she has, to contact us through
our social media.
We have Myasthenia Gravis Society of Kenya on Instagram, on Facebook. And then we can add them. No, we don't do it. But we can add them to our group, and we can see where we can get from there. Because we don't have any donor fundings. We raise funds to help each other, and when we have medicine to share, we share. We there's a time Donald had a couple of mestinons. I had two when I was put off of them, and we were being given like a lot. He has insurance. I was under insurance. So when we get a lot of those medicine, we share with the group members. That's how we survive and cope.
I want to ask though, I know it is very difficult to pull a Serikali's idea, but what do you think are things that can be done to kind of help patients with MG? Government or insurance?
Can I go?
Start.
Yeah.
Start and finish.
You see the way NHIF covers kidney issues.
Right.
Those things. Imagine if just NHIF could sort people with autoimmune conditions. We'd be so grateful. Because one consultation with my doctor, it's 4,500.
This is your neurologist.
Yes. This is a person you see, especially that guy, Francis, that's starting out. He'll probably see the neurologist once every week. So you're telling that person to spend 20,000, not on medication,
Consultation.
Just see.
consultation.
Yes.
One bottle of Mestinon has 20 tablets. It's 1,000 roughly. On a day, you take 4
Or 6.
or 6.
Yeah.
So
Starting.
after every 4 hours, you take a tablet. A tablet is 50 bob.
You said they're 20,
Yeah, 20. So if you're taking 4 per day,
like 3 days.
you're done.
Yeah.
So that's 1,000 bob every 3-4 days. So if some of us are lucky, we got medical cover, maybe from our employers, maybe from our spouses. If you're not lucky, Willis, this thing can
We've lost members.
you can go to bankruptcy. Because I remember 2017, 2018, 2019, I used to spend 35,000 a month. A month. Haujakula na unajua ukuli kila kitu. Autoimmune conditions, there's also the food you manage it through what you eat.
Right.
So if you spend 35,000 in this country at this point, we all know how the economy is. It is not a cheap affair.
Right.
So if NHIF, if anyone from Ministry of Health can just listen, that would be the best thing they could ever do with people with autoimmune conditions. If the NHIF, you can just go to hospital, even if it's Kenyatta, public, not necessarily the private hospitals. If you can just go to a public hospital and get sorted with NHIF cover, that would be amazing. But I've seen there's a legislation that they're doing on NHIF. NHIF has been told there's a suggestion to cover autoimmune conditions. So if that goes through, that would be perfect. Yeah.
Can I add something to that? You see, there's this thing whereby disability, PWDs, and I feel like having myasthenia gravis, it genuinely impairs all your voluntary muscles. So easily you can find yourself not working, not being able to do the basic stuff.
Yeah.
Tax exemption for people with disability, that is there. But they make it so hard for people with invisible disabilities to get exempted from things like that. And that's what as MGSK, that is what we are fighting for so much. Because if we can get exemption, that little tax that we pay, that can be used for medication and management. And it's been the hardest of things because even I have tax, I have the PWD card, he has. You have, some of us have, but some have been denied because they don't look fully disabled. So you're wondering, how should I look? And I'm telling you that I cannot stand from, like where I'm seated, I cannot stand without any help. But you're telling me, but you look okay. You see that ignorance. Yeah.
I don't call it ignorance. I call it lack of information.
But you're not trying to research.
You know, if until it knocks at there, unless it knocks at your door. Even today, Willis was telling us he's not aware of MG. So if it doesn't,
actually, I wasn't aware about it until it was brought to my attention.
So if that thing, it doesn't knock next to your by next door, I don't mean your family member. I just mean someone in your circle. You would know. And until it comes close to you, that's the point where now people start listening. I remember the perfect example is when the former late president got the accident in Machakos. At that point, people with disabilities walipata tax exemption. At that point, until it knocks at your door, that's when it gets recognition. So that's why we are doing this. You are wondering why we are here this June is Myasthenia Gravis Awareness Month. So basically through our social media pages, we've been talking to people, we've been sharing information about MG. So we usually say this, every time I tell someone about MG, I'm knocking at a door. And one day, this country, MG will be given that, not necessarily MG alone, these people with autoimmune conditions. So people with autoimmune conditions will get recognition and they'll, especially the hospital side of it, if they can get access to medication and medical care, that will be we will be halfway home.
Because we've lost many members because of lack of finance. We had a child, I can't remember his name. What is it? That is back in 2019,
2020.
Yes, he was taken to Nakuru or referral. Then They didn't realize it was MG. They couldn't do much. Brought him to Kenyatta. He spent the hospital in a crisis 3 days. He just died without seeing any doctor.
Yeah, because they didn't have cash.
Yes.
Simple.
So it's very sad to see you losing members, and even just because of finance.
Right.
So if these things can actually be accessible, we just need proper healthcare in Kenya, not just for autoimmune, but generally just proper healthcare.
I agree.
These are things that
I agree.
we should push for in the next debates.
Right?
Sneak in a question
Yes, healthcare.
how that is supposed to be. All right, so you mentioned how you can people can get in touch with you, because I know that's the question I'm going to get from today. So it is social media.
Yes.
It's
Myasthenia
like it is on your
Gravis.
shirt, right?
Yeah.
Society of
Myasthenia
Kenya.
Gravis Society of Kenya.
Yes.
Yeah.
Okay, so that's how you can find them. Of course, there it is. That you can
Oh, no.
find them that way, right? And you can also get in touch with them, and just over and above everything, for the sense of like you said, when you got diagnosed, you thought you're the only one in Kenya.
Yeah.
So even for that sense of community and family, because you might be single or living alone and such. So it's good to get in touch with them, and that way, and also create more awareness, which would be a good thing. How can they get in touch with you?
Okay, for me, you'll find me at Mata, Karen Branch. It's located at the Well, or on my Instagram page, which is Liz_Shiko.
All right. Well, we want to end it there. Unless is there anything I've left out?
I usually advocate for activity for people with autoimmune conditions. So there's a saying that if a river is stagnant, it starts to stink. So if you keep your body active, it helps a lot with, first of all, your psychological well-being. So basically for me, I took up cycling. I don't know what it has done to my body. I was telling Doc earlier, I don't know the correlation between my cycling and my management of MG. But occasionally, once or twice a week, I cycle around. So if you find me on my bike around Nairobi, be kind to me. So it has helped me manage my condition. So I always encourage people to find something to do. I remember we fought about this with my doc, because you get fatigued. So he was like, how do you want to cycle? So we agreed we start small. And usually say, we take things small, as in, if you eat pole pole, usikule kama glutton. So you start eat pole pole. So that's what I did, and it has worked for me. So I usually encourage, you should find me in our WhatsApp group, telling people, don't sleep the whole day. Even if you're sick, panda stairs teremka. Panda stairs teremka. It helps with your body, and I don't know what it does, but there are those endorphins.
Endorphins.
They're called what? Those good hormones. It helps in feel good, generally well-being. Yeah.
All right. Well, you want to say something?
No, same thing.
Okay.
We started cycling together. So
Okay.
That's
during the COVID season.
That's how we bonded with him.
All right. All right. Cool. Well, first, as we wrap up, I'd like to say, I think now having known more about it and what you people are doing, like Doc said earlier, I think it is something commendable. Congratulations. Keep doing that. Keep reaching out. I think the old song says we all need somebody to lean on. So keep doing that. And if you want to get in touch with them, you'll probably, if you're watching this now on YouTube, or if you now want to get in touch with them and you forget, you can get in touch with me. We'll reach out to them. I'll pick the contact from here. But you can also search for them, like they said, Myasthenia Gravis Society of Kenya, on social media except Twitter. So you can find them there as well. And let's reach out. Let's hope the government does something. Wale watu muna monitor ndo mwende mreport. Weka yuko report ya leo. Autoimmune. Just hasten the process of legislation and anything that can help. Healthcare is a big problem in this country. Something that should be talked about even in campaigns, even as we move forward for whoever it is who will take over. We'll see you tomorrow. Thank you so much for tuning in. Thank you so much for your feedback. I know there was some more. We couldn't get to all of them. For those of you who want to reach out later on, like I said, you can find them the way I've said. Tuonane. Mungu awabariki sana. Na tungoje Man U sign watu. Peace and love.